Hey everyone, thanks so much for joining me. I am with Slice of Healthcare. My name is Jared Taylor. One of my favorite conversations to have on our channel is partnerships. And today we have two members of Imagine360 and Quantum Health here to talk about a recent partnership that they have. I'll let them both introduce themselves. Chris, we'll start with you, and then we'll kick it over to Veronica, and then we'll dive deeper into this partnership.
Great. Jared, thanks for having us today. Chris Cigarran, Chief Commercial Officer at Imagine360. Really looking forward to the conversation.
And I am Veronica Knuth, and I am our Chief People Officer. And again, to Chris's point, super excited about this partnership and talking about it today.
Well, let's kick things off with Chris. Can you give us some context on the Ardent Health partnership and really how that came about?
So, Jared, this is a really unique and exciting partnership that we have with Ardent Health System. As you know, health systems are extraordinarily unique and really complicated organizations. Some of the most sophisticated organizations that you'll find in the country. They're where we turn in times of need for family members when things are generally going wrong. And we have to put a high level of trust in these organizations. That being said, they're also generally the largest employer in their geographic area, whether that's a rural health system or a health system in a major metropolitan area. And they too struggle with rising healthcare costs, which is interesting. So Ardent came to us basically saying, we are done with the traditional managed care solution that we've had for our employees. We need a better solution, one that drives higher quality care at a cost-effective rate for our employees. And their belief, which we agreed with, was they were uniquely positioned to do that. And so we sat down with the executive team at Ardent, including the CEO and the CFO, the head of HR, and the head of benefits, to jointly design a new program for their employees that would leverage the high quality care that you find within the Ardent Health System, create with quantum support a high touch system, a concierge level navigation system for their members, and also provide price protection for their members through the process. And this included a redesign of their pharmacy solution as well. We couldn't be more excited about the solution and the partnership between our three organizations.
And Veronica, is there anything else you'd like to add about this news and this partnership, even more broadly?
Yeah, I think, Quantum Health and Imagine360's partnership will offer Ardent Health's more than 23,000 team members independence with a really powerful alternative high cost managed care network, and a better member experience with expert support, improved clinical outcomes, and cost savings. And I think why this partnership and why this message is so relevant now is reference-based pricing and alternative health plan solutions can really feel challenging for some employers to consider or even adopt, but they're gaining traction as a strategy to help control costs. And we have a long-standing relationship with Imagine360, so it's a natural fit for us to work together on behalf of our client, Ardent Health, and together we can implement Imagine360's reference-based pricing model and support it by our industry-leading healthcare navigation platform. Our warriors will help ensure that the Ardent members have the best possible experience while also getting the most appropriate and cost-effective care.
And I know, Chris, that Imagine360, it's an alternative to traditional managed care. For those who aren't familiar with the company today, can you share more about your health plan offering for self-insured employers?
Absolutely. So first, let's start with just setting some context in terms of fundamental beliefs that we have as an organization. So we believe, based on data and experience, that the American healthcare system is ultimately failing the average American worker. How do we know that? We know that from the data. If you look at deductibles since 2011 have risen by 70%, far outpacing wage growth. If you look at the data in terms of medical debt, sort of a third of Americans have to take out a loan to pay for healthcare, and that's for insured Americans. if you look at deductibles and you think about a specific example, I think we spend probably too much time talking about general statistics and not enough time talking about specific individuals. So just picture somebody who's making $60,000 a year before taxes. That person has a $7,000 family deductible. What happens to that person when in January they end up in the emergency room with a severe case, right? And they've got to come out of pocket for $7,000 before their insurance really kicks in. They can't pay that bill. I mean, you're talking about over 10% of their take home pay. And guess what? They have other things they're paying for. They're paying for rent, they're paying for food, they're paying for their kids, they're paying for everything else that we all pay for. And I think oftentimes we forget about these people when we're designing benefits and as we've ratcheted up deductibles. And so that's why we believe, again, that the system is fundamentally failing these people and why we exist. So when you look at what's causing this, part of what we believe is causing it is that the people who are negotiating contracts on behalf of self-insured employers are not negotiating in the best interest of the employer clients. How do we know that? Well, if you look at specific services within a health system and a hospital and what people pay, on average, commercial patients are paying 2.5 times what Medicare pays for the exact same service. So it's completely illogical. And if you talk to people who understand this and you ask why, there's not a good answer, right? And so you put all these things out there, and our organization said, enough is enough. This doesn't make any sense. We're going to do this differently. We're on a mission to make healthcare fair for the people that we serve and the employers that we serve. And so what we've put together is a fully integrated health plan solution that really takes the employer and the employee and puts them first. We start by contracting with high quality health systems across the country that are interested in a different kind of relationship with the employers in their markets. Then we wrap that in partnership with Quantum with a warrior, as Veronica put it, who really guides a member through that healthcare journey. Because as they say very well, nobody chooses to enter the healthcare system. When they do, they need a guide. Right? If you've worked in healthcare for as long as we have, you know how to guide someone through. Most people don't have that luxury and they get lost in the system. And through our partnership with Quantum, our members have a guide through the process, right? Which is really important. If a member happens to access care outside of one of our partners, that's when reference-based pricing kicks in, which pays claims for the provider based on one of two metrics, plus a fair margin for the provider. And so you put all this together, you got a high touch, warrior driven member experience. Members are paying a lot less than they would in a traditional plan, and member satisfaction is significantly higher. And we believe that it's a better solution. It's time that employers look at an alternative solution. We're excited to bring this to Ardent. We're excited to bring it to the market as well.
I'm excited for this relationship between both of you. I think it makes a ton of sense. And obviously we've, this is kind of a new relationship, right? In talking with you, Chris, but we've had Quantum Health on in the past. And then I know actually the next thing I'm going to ask you, Veronica, is kind of in line with that. I chatted a little bit with Zane at Vive, and it seems like there's a lot of exciting news coming from Quantum Health these days. I know it was the Vanderbilt Health news at Vive, and now this new partnership and new client. Can you talk me through a little bit about, why employers are gravitating towards more of deploying your navigation platform these days?
Yeah. So many self-insurers like myself are, we have companies that are seeking strategies to contain costs. And this collaboration is a great example of how we've partnered with a leading health system in Ardent, an innovative TPA and Imagine360 on alternative payment arrangements that deliver on our mission to make sure nobody navigates their healthcare journey alone and drive significant cost savings. And we can do all of that without sacrificing the member experience. Our relationship with Vanderbilt was designed to also help self-funded employers combat the high cost of traditional managed care networks while again delivering on better experiences. And that leads to less unnecessary care, improved clinical outcomes, and better cost management. And I think both health system collaborations, while just a bit different, address the leading concern of self insured employers and are designed to improve the member experience, ultimately resulting in better health outcomes and cost savings. So it keeps the members and when they become patients, it really keeps them at the center while addressing all of the other concerns that employers have.
And this is the question kind of for both of you. It seems like employees' health benefit expectations today have vastly expanded, right? And they're looking for a healthcare experience that is it's easy, it's streamlined, just like much of their other lives, right? The phone, uh, the smartphone allowed us to do everything at the click of a button. Now everyone expects everything to be done at the touch of a button or seamless. How much of a role is navigation and enhanced member experience and that support playing in this particular offering? And maybe Chris, we'll have you quickly, add your 2 cents, and then we'll kick it back over to Veronica.
That's great. Yeah. So the member experience is critical for this because you're not just talking about employers and employees navigating the healthcare system, but you're talking about healthcare workers who know the healthcare system. And so I'd suggest that it's the member experience in this case is even more important than it is with just an average employer, where it's always important. The savings piece is also critically important. The combined solution that we're bringing to market saves between 15 and 30%, which is really the punchline. And the amazing thing about that is that the deductible that I mentioned, right? So an employer is able to take some of that savings, and some of our employers take a significant amount of that savings and give it back to the employee, sorry. And in terms of lower deductibles, lower out of pockets, free primary care, there's a lot of things that can be done. In addition, Jared, to your question around, hey, a seamless member experience. Some people want to just use apps for their healthcare. A lot of people, especially older people who tend to be higher utilizers of care, want to talk to a human being. And that's a piece that I think, if you asked people 5 years ago, they would have said no one wants to talk to somebody about their healthcare on the telephone. I think the data would suggest that that has not proven to be true. And part of that is because healthcare is still really complicated, and people are pretty stressed, especially high cost users when they're in the system. And so having somebody who cares, somebody who is not paid to get off the phone, but who's being rewarded for guiding the member through their journey is really essential. And then I think that's what has people call back, because once they find a resource that's willing to help them, they're going to keep coming back, and they're going to re-enroll year after year.
Yeah, I mean, I would agree with that. Chris hit the nail on the head, which is healthcare costs are complex and costly and getting increasingly more so. And when something goes wrong, the need to have a human intervention and to have every resource at your disposal, that expectation is growing as well by healthcare plan members. I think, our proprietary care management and real-time intercept capabilities combined with our healthcare warriors who are available and they proactively guide and support members through their entire healthcare journey. I think all of that together enables a human-centered technology, and we can solve as a single point of contact for all the members' healthcare benefits and needs. And I think when you bring our navigation and care coordination platform combined with Imagine360's unique solution to really get at the core of costs, and then you take Ardent Health's components of healthcare benefits administration, their technology, their digital health and human support, and we bring all of that together in one simple and effective experience that drives member engagement and drives better health and cost outcomes.
And I guess we'll kick it back to Chris now. Last question for both of you, and we'll kick it back and forth. Chris, when you partner with these, and thank you, by the way. Sorry, Veronica, I don't want you to think I was skipping over you. It's when Imagine360 partners with health systems across the country, but Ardent Health is the first time a national health system is offering Imagine360 to its employees today, right? Uh,
That's right.
let's talk about how has the market and health systems in particular responded to this latest news.
So we did a press release a couple of weeks ago about the announcement. Uh, and I would say the response from the market has been overwhelming. We've had both from consultants and brokers out in the market who work directly with large health systems reach out, in addition to direct reach out from some health systems interested in exactly what we're doing. So again, they're not just health systems, but they're also employers dealing with rising out of control healthcare costs, and they're looking at what do we do differently. And I think more and more the decision is going from just HR and the consultant to the CEO and the CFO, because they're also thinking about what is our direct to employer strategy in the market, and how do we think about what we do as an organization, as a health system, differently, as opposed to just relying on the major carriers to do that. Health systems are, I would say, getting in the business of working with local employers differently, and our solution is a perfect test case with their employees of a solution that then they can take to market. So it's been really exciting over the past several weeks since we made the announcement.
I'm really excited for you guys. By the way, it's always takes that first announcement too, right, to continue to spread the word that this is an option for other people and kind of see how they react from there. So I'm sure you'll get a bunch more reaction over the upcoming months as well. Veronica, as a CHRO, how are you looking at the benefits market today related to exploring new benefit models like this one right here, but I guess also what other HR and benefit, I guess, what are some of these other HR and benefit leaders thinking given the continuous rising cost of healthcare today?
Yeah, I mean, look, as CHROs, we completely understand that labor and employee benefits are among our organization's biggest expenses. And we also understand the role that the HR teams can and should play in helping to drive change in these areas. Unfortunately, I just saw a study in Employee Benefit News that said 67% of employees say that they navigate their healthcare journey without the help from either their employer or their health insurer, which is just sort of stunning because if you think about these folks are flying solo on health benefits, which places a huge burden on them, and it can cause multiple problems within the ecosystem. Everything from not getting the right appointments and not getting the appointments that they need. They pay more when they inadvertently go out of network for care. And they miss out on important opportunities from the centers of excellence or specialty partners that their company might offer. And so I think what navigation does is it brings together all of the pieces. It brings together the information, and it can influence the cost-effective healthcare utilization by their plan members. And so therefore, I think it's a solution that more companies are integrating into their benefits programs. And actually studies have shown that, that the use of independent care navigation is on the rise because, we know that the right kind of independent navigation can produce significant sustainable savings for companies year over year because it proactively guides the employees to the most clinically appropriate and cost-effective care within their existing benefit platform. And so that makes, this partnership even that much more special as we start to test, taking the expert experience of guiding people through the system and bringing together system alternatives that are really designed to do something different and special. So I'm excited as a CHRO. I'm excited to talk about some of these alternative plans because I think, at the end of the day, it benefits the company, it benefits the employees, which is what we're all striving to do.
Well, I want to thank you both, by the way, for joining me here today and shedding some light on a couple different topics in this new partnership that you have here together. And I wish you both nothing but the best of luck and can't wait to see how this continues to play out for both of you. But thanks so much for joining me here today.
Great. Thanks, Jared. Thanks, Chris.
Thanks, Jared.